Next, we move on to the parathyroid. Parathyroid is the 4 glands that are embedded within the thyroid tissue. So it is very difficult to locate them. So you will have to do something called as exploration and re-exploration. You'll have to go and search where it is. Whenever there is hyperparathyroidism, right? Hyperparathyroidism, it's a parathormone. Whenever there is an imbalance or excessive production, or when there is a tumor or adenoma of the parathyroid, then they will have to go for a parathyroidectomy. Same way, adenoma can also occur in the thyroid. They can go for a partial thyroidectomy. There is one procedure called this autotransplantation. What they do is like, they will remove the parathyroid gland and they place it on the patient's forearm. So they are going to transplant it on a different site, because perhaps if the real problem was not in the parathyroid, it can be left intact. Because now the physician does not know whether the real problem is in the thyroid or parathyroid. If the real problem is in the parathyroid, then they can automatically throw it off. But they do not know whether the real problem is because of parathyroid overactivity. At that time, they place it in the forearm, so that in case if they really want to remove the parathyroid, they can easily remove it, because again they'll have to do some kind of a re-exploration. So it is an add-on code. Autotransplantation is an add-on code which is usually done along with the thyroidectomy procedures. So you can very well see your CPT manual and see which are these codes this can be reported with.